The Sanford chip is a laboratory-developed test performed on one blood sample paired with a survey about your life, health, and family history. Patients who meet the following criteria will be invited to participate. Have an existing relationship with a Sanford primary care provider to order the test and manage results. Have an active My Sanford chart account to receive an invitation to participate in testing. Be 18 years of age or older. You will be asked to complete more than one survey about your health and habits, but you only need to give a small amount of blood one time to have the testing done. Before you consent to this genetic testing, it is important that you understand how the test can impact you and how the results may be used. What should you think about before having genetic testing at Sanford? Waiting for your results to be returned might cause you to feel emotional stress. Some people may feel a sense of anxiety or guilt after they receive their results. It is important to reach out to trusted family members, friends, or professional counselors if you need help to process these feelings in a healthy way. Knowing your results can help you learn new ways to improve your health. Along with your doctor's expertise, this test allows you to take a preventative approach to managing your health. It can also help your children and other family members to better understand their health risks. Your genetic testing results are protected in the same way other sensitive health information is protected. A federal law called the Genetic Information Non-Discrimination Act of 2008, or GINA, protects you from genetic discrimination by certain health insurers and certain employers based on genetic testing information in your medical record in most situations. GINA does not protect your information from other forms of insurance, such as life, long-term care, or disability insurance. There is a risk that your test results could make it more difficult to obtain such insurance coverage or cause you to be charged a higher premium. The personal health information in your medical record is protected through a set of laws called the Health Insurance Portability and Accountability Act, or HIPAA, and state laws. There may be circumstances where your information may be disclosed to others for purposes of treatment, payment, healthcare operations, or as otherwise required or authorized by law. Specifically, your doctor and those involved with your care at Sanford will have access to your medical record, including your genetic test results. A de-identified sample may also be used for future medical research. The tests on the Sanford chip are clinically validated, which means that your results are carefully tested for accuracy before being used by your doctor. It is important to know that the Sanford chip is a genetic screening test and not a diagnostic test. It uses information in your DNA to compare your existing risk for a set of health conditions to that of the general population. This test will not return all possible outcomes, and additional information would be required to diagnose you with the health condition. Any person who receives a positive disease risk result will be referred to a genetic counselor for an evaluation. You have the choice, if new advances in technology allow for expanded results on your previously tested sample, to be contacted in the future by the Sanford Medical Genetic Laboratory. Do you still have some questions about the Sanford chip? These resources at Sanford can help you get all the answers you need. Speak with your doctor at Sanford for details related to your specific situation. For general questions, you can speak with a Sanford genetic counselor by calling 888-424-2332. Visit sanfordimagenetics.org to learn more about how doctors at Sanford are using genetic information to improve patient care. The Sanford chip is a laboratory-developed test that has not been and currently is not required to be reviewed, cleared, or approved by the FDA. If you're concerned about consenting online because of language barriers or a disability, please call 888-424-2332.